everyone's an individual, and quite often you'll get a list: eat these, don't eat these, and patients say, no, 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 no. Garlic is completely fine, and another person will say, oh, I can't, I definitely cannot eat
Why
garlic.
hypnosis might work on that nervous system component of IBS. You're going to get constant irritation if that mucosal level or mucosal barrier is compromised.
Intertwined, and it's a snowball. So they're all exacerbating each component. So we could pick hormones. Yes, there is definitely a hormone component, but that'll make the mood worse, and then the mood makes the IBS worse.
Hello, everybody. Today I'm going to talk about IBS, or discuss IBS, Irritable Bowel Syndrome, with a longtime friend and fellow Integrative Naturopath Shannon Burford. We're going to cover signs and symptoms of IBS, sudden onset of IBS, what can trigger IBS, specifically what foods can trigger IBS, what should you eat when you have IBS symptoms, and finally, we're going to give you some tips on how to alleviate IBS symptoms. So, Shannon, how are you going?
Hey, Brad. Very well, thank you. Thanks so much for inviting me along to this call, and it's really good to get together because something like IBS, it's easy just to brush over, but it's such a complex topic, and we can put our two heads together and give the viewer a lot of stuff to help them.
Yes, yeah. Look, it's a massive topic, and but it's such a common clinical presentation, and I'm really curious to see. It's something we haven't talked much about over the years. It's just something that's so common that you kind of leave it aside and get into some more interesting uh, uh, cases and complex cases. Not that IBS can't be interesting; it certainly is and can be difficult to treat. So yeah, let's get into it. And
Yes.
first, let's talk a bit about some signs and symptoms and
Mm,
what
mm.
you're seeing in clinic quite commonly.
Yeah. What do we see? As you've said, it's so complex. I always use the analogy of an umbrella, just covering so many things because it's thrown out there. I've got IBS, and probably the most common one is people complain of bloating, but obviously more complex than that: constipation or diarrhea or pain, stabbing, bit of reflux thrown in there, all sorts. Yeah, I'm guessing you're seeing the same, and
Yeah,
one case is never the same.
yep, you're right there, definitely. And yeah, gastrointestinal disorders and dysfunction are obviously a common thing we treat, but yeah, IBS, it's very unique to the individual, how they acquire it, what's triggering it, and so forth.
Mm-mm.
Uh,
Yeah, once we rule out those red flags, so the obvious ones, inflammatory bowel disease or cancer or similar, then you're just left with a bunch of symptoms and the patient saying, help, I've got the worst smelling flatulence or extreme pain rolling up in a ball. Help me.
yep. And then, look, being naturopaths, we like to ask, what does it smell like? Is it like rotten eggs? Is it, all these gory details about their stool and everything else? But that can give us a ton of information and lead us in the right direction. And look, what's associated with it as well as things like intestinal hyperpermeability. You mentioned reflux as well. And look, the Rome criteria is uh, the specific criteria like abdominal bloating and pain relieved by defecation and all this sort of thing. And we had the Rome criteria 2 and Rome criteria 3. And I know we used to revert back to Rome criteria 2, and now there's Rome criteria 4 and 5, I believe, which I mean, I haven't even really taken much notice of that because we see the obvious things in clinic. And most importantly, too, as we all taught, it's a diagnosis of exclusion. So you've got to, like you just mentioned, you've got to rule out the inflammatory bowel disease and any other thing that's going on, which you can do with functional testing and other things. And dysbiosis is a very common sign and symptom. So we can often see that going on with microbiome testing and the sorts. Okay. All right. Well, let's cover sudden onset of IBS. This is something that is often presented to me in clinic when someone's done some traveling, or in their case history, we look back and we can see, oh, well, they went to Bali at this time and never been quite right and so forth. So, can you suddenly get IBS? Well, yes, in this instance, you can,
Yes.
because these pathogens can stick around. Some of them, parasites and so forth, can be cyclic as well. There's a lot of debate whether, things like for example, blastocystis hominis, are they a concern? Do people just live with them? And in some cases, people can have low amounts of these things, the same as H. pylori, for example, and be okay and be fine. But if they've got huge numbers of these pathogens, they can actually cause a lot of damage to the gut mucosa, and the gut wall, and can cause things like intestinal hyperpermeability and so forth. Do you have many cases of post-infectious IBS or sudden onset IBS in your clinic?
Yeah, for sure. And so I guess we just basket it into those two categories, the one that's just been progressively getting worse, and then the sudden. But even divorce or deaths in the family, or traumatic things in teenagers through exams, or it's a trip to Bali, but that could be the trigger to the sudden, whether it's a parasite introduction or stress or chemicals, toxicity, but it's a shift in the microbiome, and that's what's causing the IBS. So for sure, sudden is definitely possible.
Yeah, well, goes into the next thing I wanted to discuss about IBS is, what will trigger it. And you perfectly touched on stress, because it is a huge factor with IBS, and it can tie in. Like, I often see anxiety associated with things like blastocystis or a parasite as well, triggering that nervous system irritation, if you will, and then things like poor serotonin levels or lowered serotonin levels or fluctuating serotonin levels. Things like histamine can disrupt the gut function and play a role in mood and so forth. And likewise, stress then alters mood and so forth. High cortisol is lowers secretory IgA, which is your part of your mucosa, your mucosal defense. That mucosal lining then being compromised. So, yeah, when you mention stress as a trigger, it is a huge one. Also, things like hormones. There's some research there supporting things like high estrogen. We see a lot of women, when they go through menopause, can be dealing with bloating and symptoms, or when they're going through their cycle, their periods, they're at a certain stage of month, they're dealing with bloating and so forth, and that can be quite often tied in with IBS as well. And so, do you see a little bit of that in your clinic, a bit of hormonal dysregulation contributing to IBS?
Yeah, and I guess it's really important also to state, for those people out there watching this, try and take the 40,000 view at your symptoms, because it's really intertwined and it's a snowball. So they're all exacerbating each component. So we could pick hormones. Yes, there is definitely a hormone component, but that'll make the mood worse, and then the mood makes the IBS worse, and the dysbiosis, and it just gets worse and worse. So you touched on histamine and I think oxalates and things, but we can go down a path and think, oh, I've found on the internet, I found this histamine diet, and that's going to fix my IBS. Yes and no. Another one is the FODMAPs diet, but it's definitely important to look at the big picture because they're all going to feed in. And if you remove the histamine foods, sure, it will reduce a bit of the inflammation, might give you some symptom relief, but it's not the full picture answer. We're going to have to address the opportunistic bacteria or the parasites or the stress or the sleep or the hormones as well at the same time. And that's where the naturopathic holistic approach is. So just I encourage you, if you're watching this, wherever you are with your IBS, just step back and go, okay, well, what am I not addressing? Rather than going in the traditional orthodox medical way and going, isolation is blastocystis.
You often target these pathogens, but again, you've always got to consider that whole picture. And I mean, there's now apps now. I think it's the Nerva app that's working on hypnosis, and they get some results with that, and that's working on the vagus nerve, I believe, the visceral hypersensitivity. So this is where the organs and everything become the GI tract in particular becomes overly sensitive. But again, why hypnosis might work on that nervous system component of IBS, you're going to get constant irritation if that mucosal level or mucosal barrier is compromised. So you need to address that. You need to heal the gut. And then, like you mentioned before, dysbiosis is a huge part of IBS. And especially if we're looking at SIBO within that IBS picture, so that small intestinal bacterial overgrowth, which we often see the food baby presentation, where people look like they've got a little baby of gas there, and they're sometimes a bit higher up in their digestive tract. That can be problematic and cause constipation. Often we see this in IBS-C, the constipation presentation, and that needs to be addressed as well. Yeah, all those things we need to look at. Okay, so you mentioned things about histamine and oxalates and other things there. So let's talk about what foods can trigger IBS and what you're commonly seeing in clinic, Shannon.
Oh, there's a whole topic on its own.
Oh, very
But
much so, yeah.
probably the people watching this have heard about the FODMAPs. It's been around for like 15 years, 20 years. And we know about those fructose, oligosaccharides, disaccharides. So beans, classic, everyone knows they're quite hard to digest and cause a lot of gas, including fructose foods like dried fruits. But I want to say that everyone's an individual, and quite often you'll get a list, eat these, don't eat these, and patients say, no, garlic is completely fine. And another person will say, oh, I definitely cannot eat garlic.
Yep.
So you have to listen to your body quite a lot and just try to intuitively know, like, okay, that food doesn't work with me, and cut it out. And keep it very simple, as very basically stated to help you the best way. Just try to keep things as whole as possible. Avoid packet things and soups, broths, warm foods. What else would you add, Brad?
Yeah, look, I think you really said it well there. Like, it's different for each individual, and this is where I think the importance of maybe doing a food diary, even if it's just over a couple of weeks, or even a week. And so I even say to some of my patients, even try doing 3 to 5 days for me if you can't stick to a week, because everyone's busy and we don't want to stress them out further. And when I get the food diaries, sometimes there's a misunderstanding. They've heard something online, taken some incorrect advice, and the enables, by getting that information, enables us to take a deeper dive, and get some clarity on what foods are going to be triggers for that individual with this situation, and perhaps even shed some light on what foods they can have as well, because a lot of the time these people get put on these diets, like a FODMAPs diet, what have you, and they stay on it forever. Which it's meant to be a temporary relief thing,
Yes.
because you're not treating the underlying cause. The same thing with doing other interventions like the Nerva app or something like that for the hypnosis and so forth. So we kind of working in that symptom relief area, and that's great. And we need to do that. And sometimes when we're treating this condition with our herbal medicines and nutritional interventions, that we're working on symptom relief, but we're wanting to work on the underlying root causes for this condition, and we want to weed that out. And the diet component of this syndrome is usually going to provide temporary relief. We want to find out why particular foods are irritating the gut for this individual. I guess, without trying to generalize it too much, I think we should probably talk about what foods are probably beneficial to individuals who are dealing with an IBS flare-up, let's say. Again, you mentioned garlic before, which can be a real FODMAPs disaster for some individuals, but it can be ideal for others.
Yes.
And I think this speaks to underlying pathogens, what's going on, because
Yes.
garlic can be a real winner. It also can be very anti-inflammatory and help with the mucous membranes. And then dose is also very important with garlic too. And there's different types of garlic in supplement forms as well that can be beneficial, and it doesn't have those FODMAPs components if it's in a supplement form. What foods do you find seem to work well with individuals who are dealing with IBS?
Yeah, a few points that you mentioned. One is about the food diary, 100%, and misunderstanding, because sometimes, as you say, they read something or we say something and it's just slightly off track. So when you see it on paper, it's like, aha, you're having XYZ. Let's just tweak that. And it's just a slight change and that'll improve it. But also on the topic of garlic, that's a favorite one with me, but there's an opportunistic bacteria component, and the garlic can help break through that. So if I can help coach the patient through, like maybe it'll be worse or quite gassy for 2 or 3 days, but then you'll make a breakthrough. So sometimes it takes just a little bit of coaching and guiding and support to get through that, and then boom, it just gets better, and the patient's like, wow, that garlic, even though I was avoiding it, it actually helped. So there are some foods, but generally, if I'm just to generalize warm foods, even though bone broth is high histamine, there's always this double-edged sword of beneficial and aggravating, but it's very soothing, generally warm broths and soups. It could be something just very simple warming bone broth with no real vegetables or meat in it, but the patient will drink it and it's extremely soothing, and that stops their vomiting. And then maybe just adding a few things, some pieces of small cooked carrot or something, just to slowly build it up. I am a big fan of vegetable smoothies for the fiber component, but also for the antioxidant component and just the electrolytes in it as well. But there are a few FODMAPy things potentially in there, but starting very small, and it often does the trick over a couple of weeks, just slowly increasing the amount.
Yep.
Yeah, we could talk for days.
We could, and I think you touched on two important things there, and soups and smoothies can be great because they help the digestive process, and quite often you can put fruits and vegetables in there, perhaps avoiding the FODMAPs ones initially, but ones that have the skins as well, because some people they don't like the skins of fruit and vegetable, that's where all the polyphenols are. So we know polyphenols have a great influence on the gut microbiome, and
Mm.
they control the balance between pathogenic and opportunistic bacteria versus beneficial bacteria. So
Mm.
if we help the digestive process by having soups or having smoothies and putting those high rich polyphenol foods in there with some fibers as well.
Mm.
And again, fibers, we could discuss fiber pros and cons to that, for as long as this podcast could go for. But yeah, I think that's a good way of doing it. And a classic example I find in clinic is apples. Most apples will be on a FODMAP list usually, and a lot of my patients with IBS will come to me and they have terrible trouble with apples, but I switch them to organic. And this is something we haven't touched on yet either.
Yes, yes.
And organic apples they're a little bit smaller in size, but their skin tends to be a bit thicker. So it's very rich in polyphenols, and you've got that lovely pectin fiber there. And it doesn't have the nasty pesticides on it. So, glyphosate is a huge problem for the gut microbiome. And again, another subject that we could, we'll probably will do another podcast on that and talk about the organic foods and the importance of those. So yeah, again, organic foods, maybe help pre-digest them with smoothies and soups. And I think even maybe boosting digestion with some things like apple cider vinegar, lemon and water,
Yes.
and so forth as well
Yes.
can help benefit
Yeah,
people.
and those fatty things too, caffeine, alcohol, spicy foods, citrus.
Yep.
Oh, we've opened up a can of worms
Yeah,
here.
they can all be nasty, and they can be reactive, or the patient can be reactive to these foods, but they can constantly be stripping that mucosal layer and doing damage to the cell wall. So yeah, it's an important point. We've given a few tips there.
Yeah.
In relation to food. What about some clinical pearls that we could offer to help get rid of IBS or treat symptoms? What little clinical pearls do you have on offer there for people listening?
Yeah, well, I'll start it a bit, and then you can certainly add a lot more. But probably a microbiome test is quite helpful to do if you can afford it. Further screens is obviously important, but a microbiome test covers a lot. Some people do a breath test, but I'm more inclined to steer patients to do the full microbiome, because then you're looking at the actual opportunistic bacteria. I guess we could throw in some herbs there. I love classic chamomile. Even if it's just you are in the middle of nowhere, you don't have access to a dispensary or either of us to make you up a herbal, get some chamomile tea bags, put 3 or 4 in 1 cup, make it really nice and strong, and sip on that. The bitter action together with the bacteriostatic effect of the chamomile is extremely effective. I remember hearing about 20 years ago them using that in Germany for Helicobacter stomach ulcer treatment. Yeah, pearls of wisdom. There's so many, Brad. But diet foundation, getting rid of the sugars, having some warm food, simplifying the diet has to be the foundation. Adding a few herbs in there, maybe some apple cider vinegar if it's tolerated, and breathing, doing some Wim Hof breathing or triangle breathing or similar to try and calm down. And then from there, you can step by step out of it. There's hundreds of other things, Brad.
Yeah, no, you're great. Look, I love it. I love the chamomile. It's one I go to all the time. I mean, I try and correct dysbiosis. So, you could be targeting pathogens with high berberine or high berberine herb like Coptis or something like that. There's other ones you might be trying to if there's a real nasty parasite there or something, you might want to break down biofilm, for example. So pomegranate can be good there. Cistus is another one I've introduced to my clinic recently. So there's some great herbs there. And sometimes we need to go in, if there's fungal infection or something, going high dose oregano or something like that can be really good there too. And then, mucosal repair. I'm always thinking about that. Always thinking, what can help there. Something like your SB, Saccharomyces boulardii, can be very good at competing out with other yeasts like Candida. It has a healing mechanism, increases secretory IgA. And the obvious ones like bifidobacteria and lactobacillus, they're often stripped down, especially if there is a parasite or pathogen there. So just giving a probiotic, but it's always important to add in the fibers in the diet, the polyphenols as well. It's going to support the growth of the beneficial bacteria and limit that opportunistic bacteria. So yeah, and you touched on stress management as well. So with the breathing, this is incredibly important. I even see the benefits with inflammatory bowel disease. That's just how great things like meditation can be as well. So
I'd like to just throw in there with what you spoke about also, and there's a difference as well, because you can go one way of killing off, but you can also go one way of repairing or supporting or replenishing. So for you out there watching this, just think also about, like, do you have gastritis? Do you have more repairing need, or do you have killing off? Because sometimes patients come and they're all focused on the killing off. There was one lady and she was on all of oregano and some other strong herbs for years, but the microbiome showed her that she was so stripped, she had no parasites, she had no bacteria. So it was going in the wrong direction. We needed to more replenish. But that can be, without a test, it's quite tricky to know, but you can possibly just understand, do you have symptoms of gastritis, where the symptomatic treatment comes in. But I guess two parts to it.
Yeah, and quite often you can always start the healing process while you're eliminating some of these things too. It's quite it's more a common practice now to go in with something like SB initially, even if you're taking out some of these pathogens, because the healing process, it's never too early to start that as well. You probably avoid things like prebiotic fibers that can increase the growth of bad pathogens and opportunistic bacteria, but you can outcompete the opportunistic bacteria with the probiotics and using something like SB, and that will help.
The SB is great.
Heal the mucosal barrier too.
Less
but there's so many ways you can go about this, and like you said, it's very individual. And you have to do good case taking and good assessment. And then if they can afford functional testing, great. And then you can get all that data and put together a great treatment plan for that individual. Well, I think that about wraps it up. I think we covered a lot, Shannon. So where can people find you?
Oh yeah, I think people can find us through our names on through our webpage, but Cura Medicine or Shannon Burford. And Brad, how about you?
Yeah, so just Brad Parkinson Naturopath. Usually I'll come up Facebook page, or my website will come up under there, so people can...
We're everywhere, aren't we?
Yeah, we're popping up everywhere at the moment, which is good. So, all right, well, we'll wrap it up there. Thanks, Shannon. Great
Thank you, Brad.
Talking about this with you. And until next time, we'll see you later. Bye for now.
Thank you. See ya.